Okay, so back to our diagram, as I was mentioning before, all of the nutritional relationship with how your thyroid actually works. And again, how many of you have had a doctor sit down and say, we really want to be concerned about nutrition in your thyroid, and chime in. If you've had a doctor sit down and talk to you about nutrition, great. If you haven't, I'd just like to kind of poll you guys to see what you've all been being told. But some research on this, right? So multiple nutritional factors in the risk of Hashimoto's thyroiditis. You can see here there's evidence from the observational and randomized controlled trials that selenium can reduce thyroid peroxidase antibodies. So if you're familiar with that, TPO antibodies are one of the markers that your doctor will measure to help diagnose you with Hashimoto's or not, right? And so in this case, selenium, adequate selenium will reduce these antibodies. And there are a number of mechanisms behind how that works, but a number of studies have shown that. We also know that iron deficiency impairs thyroid metabolism. I showed you that earlier. The conversion of T4 to T3 requires iron. We also know, moving through this, we know that because many with autoimmune disease that have autoimmune thyroid disease also have autoimmune gastritis. These two oftentimes go hand in hand. And one of the problems or byproducts of gastritis is low iron. And so if you're autoimmune thyroid, but your gut is also damaged and inflamed, you're going to reduce your capacity to absorb iron. And if you're also menstruating, you're losing iron every month. You can see how this could become a major problem. And if you cross-reference the symptoms of iron deficiency with the symptoms of hypothyroidism, they look very, very similar. And so one could argue, is it hypothyroidism, or is it really iron deficiency contributing to hypothyroidism and just being diagnosed as hypothyroidism, and the doctors are just not looking at iron at all? We also know that lower vitamin D status has been found in hypothyroid patients, Hashimoto's thyroiditis patients, more so than in control groups, and inverse relationships of vitamin D with TPO antibodies have been reported. In other words, the lower your vitamin D, the higher your thyroid antibodies tend to be. So their conclusion in this paper was clinicians should check patients' iron, particularly in menstruating women, and vitamin D status to correct any deficiency. Raise your hand in the comment section if you've had your vitamin D and your iron levels checked by your endocrinologist, or if they were just putting you on thyroid medication and telling you diet and nutrition had nothing to do with it. Adequate selenium intake is vital in areas of iodine deficiency excess, and in regions of low selenium intake, a supplement of 50 to 100 micrograms a day of selenium may be appropriate. So again, this is a nice little paper on vitamin D, iron, and selenium. Let's see here. Here's a nice one on inositol. Now, I mentioned earlier that inositol was important in the production of thyroid hormone, but this was actually a human trial where they were using inositol in autoimmune thyroiditis. And you can see here, inositol has a determinant role in thyroid function in autoimmune disease as it regulates iodine organification and thyroid hormone biosynthesis. So again, plays a role in the production of thyroid hormone. What we know is TSH levels significantly decreased in patients with subclinical hypothyroidism with or without autoimmune thyroiditis after treatment with inositol plus selenium. So this was a kind of a combo where they were using the two in tandem together. In addition to TSH, so in essence, the TSH improved. They saw a lowering of TSH. Remember that high TSH equals low thyroid function. A lot of people get confused about that because they're opposite. And then what they also saw, though, by giving this combination of nutrients, is they saw a reduction in antibodies. TPO, thyroid peroxidase antibodies. So, again, how many of you have had an endocrinologist put you on inositol or selenium? And how many of you have had an endocrinologist bother to even check your inositol or your selenium? So nutrition, very, very important. Here's another paper on some factors, nutritional factors around the management of autoimmune thyroid disease. Now, I like this diagram here that this author put together. You see here is kind of three contributing factors centering in on Hashimoto's. We've got genetic factors. A lot of doctors will say, low thyroid is genetic. There's no other contributing factor. You're just going to have it because it's genetic, which is nonsense, but that's not to say that there aren't genetic factors. Well, one of the genetic factors is what's called the major histocompatibility complex, or the MHC. Now, this is part of the same genetic factor that we look at for gluten, but one of the major genes related that we're discussing here is something called HLA-DQ genes. And so these genes, certain parameters of these genes, or certain variants of this genetic marker. There's an alpha-1 and a beta-1 HLA-DQ gene, but certain variants of these genes will increase the predisposition or likelihood of the development of celiac disease, which is also associated with Hashimoto's, which is also got association with rheumatoid arthritis and type 1 diabetes. So these are all, what is the trend here? These are all autoimmune diseases, and that's what these genes are predisposition genes to the development of autoimmunity. And so that's where there is some genetic overtone. But remember, if we're looking at how much of it is genetic versus how much of it is, all the chemicals we've been talking about, the nutritional deficiencies, the potential for eating gluten, 30% is genetic. Pretty much the rest of the 70% is a combination of what you see down here, which is environmental and nutritional factors. And then as well as some of these factors over here you can't really control. I mean, well, you can control whether or not you become a parent, but you can't control your age. It just happens, and you can't control, well, you shouldn't be able to control your gender, although some are trying to argue that nowadays. I don't agree with it, but gender and age. But here we have environmental and nutritional factors: smoking, alcohol consumption, iodine deficiency, selenium deficiency, vitamin D intake, whether or not you have the presence of infections, and then environmental stress and certain medications. So, I would add to this list of things all the chemical disruptors that we just talked about. So, but again, in this study, you can see here, observational and controlled trials have shown frequent nutrition deficiencies in Hashimoto's thyroid patients. In literature, there is evidence for selenium, potassium, iodine, copper, magnesium, zinc, iron, vitamin A, C, vitamin D, and vitamin B. The role of the proper level of protein intake, as well as dietary fiber and unsaturated fatty acids, especially the omega-3 family, has been indicated. We talked about a lot of that already at the beginning of the show here. Hashimoto's thyroiditis patients should often eliminate lactose because of intolerance and interactions with levothyroxine, meaning that a lot of these people with Hashimoto's are also gluten sensitive. Remember, there's that connection. And it's a rough estimation, but it's 70+% also have lactose intolerance. And this can create problems in the bowel. It can increase the risk for abnormal bacterial overgrowths. What they're kind of referring to here is infection. It's really more of an overgrowth. But also because of the interference as well with absorption of thyroid medication. And then you see here, and gluten because of possible interactions with gluten or possible interactions of gluten with thyroid antigen. So again, just a quick summary: lots of nutrients listed out there as being important, but also being present in the medical literature. In other words, things that have been studied to be low in patients with Hashimoto's disease. And so you definitely want to understand that, because if you do, then you can ask for the right tests.